right, so we'll then go straight into our Q&A session. Some very important points raised by our panelists and lots of questions coming in on the chat. I see some of the panelists have tried to answer them on the chat as well. Okay, there's a question here from Bulalani. The Continental Free Trade Agreement can be leveraged to make some of the ideas I've proposed. This was the answer from Chidi. Sorry. Okay, so Cornelius has asked, vaccine manufacturing is justifiably dominated by viral agents, but with the looming threat of antimicrobial resistance, especially bacteria, maybe bacteria needs to be considered as well in terms of vaccines. So maybe Simon, if you want to take that.
Well, I mean, it depends on, again, that, I mean, if you listen to my presentation was focused on not only the vaccine, but surveillance. So the tool that we are developing, we allow us to understand the key diseases that plague us. So that's the first place to start from. Based on those analyses, find out that a particular disease is of interest, then it will inform the vaccine manufacturers. This is a problem. How can we develop vaccine to protect against that disease? You know, so the first thing that I always say that we need to do is to bring in these technologies first, because you know, we keep saying, well, you know, you have to build this, you have to waive the intellectual property, you have to do that. But the key thing is bring in the know-how first. Once you have the know-how, you can always use that to address whatever problem that you have on the continent. But without the know-how, there's nothing you can do. So right now, you know, like Mr. Suri said, we need to, I mean, partnership is the key thing now, because we don't have anything. You have to partner and then bring in the technologies. Once you bring in the technology, like I presented our platform technology using the virus-like particle, it's a platform technology that you can use to make different vaccines. You know, I mean, like I said, we use that platform to make HIV, Ebola, and now we're using that platform to make COVID. So if there is disease X, we'll use the same platform to make that. So it should always be platform-based, a single technology for a single disease. If not, that particular factory will not be profitable, because COVID will come and go. What happens to the factory if you are building it just specifically for COVID? So in summary, what I'm saying is that if you embrace platform technology, any disease of interest can fit into that platform.
Simon, that's a very important point that you raised, and Raj raised it as well, saying what happens when COVID goes away, right? And what is your advice to potential vaccine manufacturers in terms of choosing appropriate technologies? I mean, what are the critical decision-making factors? And, you know, how did you come to the decision of choosing that particular technology? Because at the moment, like Raj was saying, everyone is chasing mRNA vaccines as the new big thing, and saying that that is the most flexible technology around, but you choosing something else. So how did you come to that decision, and how agile is it going to be for the future? From what you're describing, it seems to be quite flexible.
Excellent question. When you start with a well-established vaccine platform like what we're describing, you know that, number one, whether with COVID or without COVID, everybody is using COVID now because there's a lot of resources. And it was on that basis that we capitalized on that to get the resources that we need to advance the mission of building the vaccine factory. The key thing that will sustain those factories, what we know, part of the national program, HPV, which is the human papilloma virus, of course, that causes cervical cancer. The vaccine has been introduced in 22 different countries in Africa, but we don't have enough product because there are only 3 companies that are making it, GSK, Merck, and Innovax. It's a Chinese company. So whether with COVID or without COVID, you make HPV vaccine, that's enough market for you. Now, the malaria vaccine, the Oxford malaria vaccine that is in phase 3 trials now, it's also based on VLP. And where will you want to manufacture malaria vaccine other than Africa? So Serum Institute licensed that technology from Oxford, and then they will manufacture the vaccine and import. So why not have the technology on the continent? Because this is where we have the problem, malaria, and produce the vaccines locally, even if it is sub-licensing that technology from Serum Institute. So, and that is the point that I'm making, that it's not more about, about the technology, is about having the know-how. Because why did Oxford go to India instead of Africa, where you have malaria? Because there's no capacity right now on the continent to produce that. So you have to go to where the capacity exists, and then you produce that and bring it in. Now, if you look at the mRNA thing that we're going through, it's a new technology. We don't know yet where we are going with that. There's no way, based on the data that we have generated, it shows that within 6 months, you have to be revaccinated. There's no way the world can afford this. Now, it took time for us to even start getting COVID vaccine in Africa. Now you have a new variant. Now the focus of the companies is to make vaccines specific to this particular variant. And guess what? Who is going to buy those vaccines? The West. So we're back again to square one, that we're going to service, and by the time we vaccinate the West and then we have the products coming to Africa, another variant will come up. And the companies will focus on the new variants. By the time you are trying to implement that particular vaccine, the new variant will come, and the West will buy everything up. Without local vaccine manufacturing, all we are doing is a waste of time. India, look at a typical example. India, I love the India model, and I speak about it anywhere I go. You leave manufacturing in the hands of the private sector. The government creates the environment for the private sector to thrive. During COVID, Indian government gave $426 million to 2 private companies to de-risk the production of vaccines. What did the company do in return? They sold, that's the Serum Institute and Biotech, they sold the vaccines to the government at cheaper rates than selling to other companies. So there's, without the government involvement on the continent, all we're doing, we're just wasting. That was why I mentioned that thing, that advanced purchase commitment. There's no, if you go take a loan from IFC, build a vaccine factory, the focus initially would be, how do you pay that loan? But if the governments understand that this is an emergency, we need to get this, we need to make this happen. We are giving you, let's say advanced purchase commitment. We're buying 20 million doses, 100 million doses of the vaccines in advance to help you set up. The government will achieve 2 things. You will help the local company establish, and then you still get your products. So the local company we have cheaper funds to build a factory. So that is another discussion that we'll be very happy to engage with, discuss how to make this happen, going forward.
Thank you for that, Simon. I just want to get to, Paul mentioned the people, the importance of the people aspect. Raj mentioned it as well. So I'd like to come back to both of you. Farhan also asked a couple of questions about that in terms of the focus on youth and university. So my question to all of you is, what is your message to educational institutions as well as policymakers on what needs to be done in terms of getting people trained to be employed in these manufacturing facilities? And are our current universities and tertiary educational institutions fit for purpose for what is needed in terms of creating sustainable manufacturing going forward? Either one of you, Raj or Paul, can go ahead.
Yeah, to start with, what I would like to emphasize here is that the focus of education has to be industrialized training. You see, the most important point is that if you're talking only theory, that I've read the books, I have passed the exam, and I don't know anything. When you ask a question, I have interviewed more than 20,000 people in my career. So when you ask the question that how a fermenter works, they have no idea. They have not even gone through, handling any fermenter as such. So this is, I think, very important to understand whether they know what is upstream, what is downstream, what is solution formulation, how the QMS works, and what are the regulatory requirements, and what is the quality that we are talking about, and what are the safety aspects of an injectable vaccine that we are talking about. They have to understand. This has to be, they have to breathe that air. And this has to be cultured into the educational institutions, the biotech institutions, the universities, where this kind of training, even on a smaller models, they have to inculcate that habit of understanding what is industrial manufacturing. And then from there, they qualify into a GMP facility, and then they can immediately take on. So this is something very, very important, because today the curriculum definitely needs to be reviewed well in advance if we are preparing Africa for the next generation.
Part of what has not happened, again, is the full implementation of the pharmaceutical manufacturing plan for Africa. Education, educating the people who will be producing pharmaceuticals is something that was heavily stated in there. And as a result of that, some institutions started up. University of Ibadan, for example, has the Faculty of Pharmacy established a Center for Drug Discovery, Development, and Production. And the PMPA, as it started being implemented by UNIDO would sometimes give scholarships for people from the industry to send their people there. The other place was the St. Luke University Kilimanjaro School of Pharmacy in Arusha, Tanzania. Tanzania doesn't have a huge pharmaceutical industry like there is in Nigeria or Ghana or Kenya. The web thing that I think it was Chidi who was talking about that. So you had a place that doesn't have the big industry, but they set up a training center. And again, UNIDO supported the industry. We took advantage of it. My company took advantage of it. And we sent people in there for QC training, for QA. But then in addition to that, like Raj is saying, you do have to have actual hands-on training. And that's the reason why in our company, we also set up the training where we were training people from for other companies. And so this is the mindset we have to get into, that the training, we can't expect somebody will give us trained people. We need to take advantage of the educational system that we have, and we ourselves pick on and train, bring people in to help to train, send people out to train. And that's what I think needs to happen.
So Paul, just a follow-up question on that. You're talking about the lack of implementation of the PMPA business plan, which raises a broader question of policy implementation, which plagues us a lot. What do you think needs to be done in order to break the cycle of us producing amazing policy documents and policy plans, but then we fall short on the implementation side? I mean, you wrote a really great paper on the evolution of the pharmaceutical industry in Africa, and you compared it to the sector in India, and our growth trajectories are quite divergent. What is your message to policymakers in terms of creating this enabling environment? All of you mentioned the enabling environment, but we don't necessarily define what that enabling environment needs to be and what we need to be doing from an action point of view.
Yeah. You know, the PMPA came about because of the realization HIV, where HIV is most prevalent is Africa, and we didn't have the capacity to make antiretrovirals. Everything was imported and so on. So why not build up the industry? This is what was said. If you look into the plan, what Raj is talking about is all in there. If you have a viable industry, there will be industries that will be coming up to make the packaging material, industries that will be coming up to actually manufacture equipment. And that is what happened in India. And that is the example that this was following. The difference here is putting your money where your mouth is. India established Schedule M, but they also set up things like the credit-linked capital subsidy scheme, which is the government actually putting money in where company can go borrow at a certain level and improve. The government paid close attention to the development of the industry and put their money where their mouth was. That is not what is happening in our case. We come up with the policies. They are excellent. They are well thought through, a lot of input. The advantages that will come out of it, the education, and it's a science-based industry, etc. It's all there, but it's unfunded. The part of the pharmaceutical manufacturing plan for Africa, that is building up regulatory capacity and coming up with an African Medicines Agency. That part got funding from the Gates Foundation. And look at what happened. That's why we have AMA. But then the part where you will create some funding that understands the industry, that it takes 5 to 8 years to profitability, compared to when you try and borrow money from a bank that is looking at you to pay up in about 3 years. So that part about establishing a fund, that has not happened. And so we've come to this stage again. We're talking about vaccines and we are looking at COVID-19. What is going to happen? All of these policy papers that are coming up, where is the commitment to put money into it? That is the issue. It's money that is needed, it's funding that is needed, creative things that would enable the private sector to access funds that would operate with them, funds that understand what their issues are. That is where we are.
Thank you. Chidi, you wanted to add something to that?
Yes. Beginning from the previous discussion about the role of higher institutions, I think that has been dealt with. But just to add that industries also need to approach universities and partner directly with them, not waiting. And when we were younger, we understood that back then in Nigeria, while students were still in the university, industries went to the schools, to the universities to actually cut for students who are still, engineering students and others. And while they were there, they actually linked them up. And by the time they are graduating, these industries are absorbing them and hands-on experience. Why should an engineering student, a mechanical engineering student graduate without ever touching a car or trying to couple a car and so on? So I think it's the industry also needs to take the initiative to really collaborate with the university, the higher institutions. Now, talking about policy implementation in Africa, I think, see, one challenge I think we have in Africa, this is an area I don't like discussing because it's very touchy. You know, it's because, see, most of the time we act by emotions without thinking through issues. Oh, there's COVID, everybody is manufacturing, and you see presidents making it because it is politically correct and they really want to show that they are doing some things without sitting down to ask some hard questions that will really help them to plan properly. All the things we've discussed here, they need to think through. You said, oh, you will give 10 million, you want to set up, who is going to man those factories? Where will your drug substance come from? Where will the other materials come from? Is it just giving 10 million to do something? No. At the end of the day, the president leaves office, and because he did it as me, when he leaves, his successor doesn't see anything to work with, abandons that project and moves on. Policy inconsistency. And there's a word we've all been running away from, which I really wish I don't have to say it. You know, and that is the issue of corruption. I mean, many of our leaders are only interested in what comes into them. I say I don't like discussing this bit because it's very painful. It's very, it's very hate. I don't like it. But we're talking about practicalities and we have to talk about it. The other thing is this consumer mentality we have in Africa. Until we let go of the consumer mentality, we have, like, I think it was Paul that mentioned it. Africa has one of the best brains in the world. So what is wrong? So until we let go of this consumer mentality, because it's affecting the way we implement policies. Tell me why we have the number of private jets in Nigeria alone will conveniently fund the budget of most African countries. And I'm not joking. The parking fees alone will fund the budget of many African countries. Why should we be waiting until somebody from the global north comes to fund something for us? So that is a big challenge. So policy inconsistency, poor commitment by our leaders. And these are some of the things that are really affecting, like the PNP, beautiful. How many, 10 years now? It's been there. Poor implementation. And then we turn out, now everybody is rushing. How many of the people that are actually wanting to implement the COVID vaccine in their country, how many have really started to think through all the issues we are discussing here? If you do a critical appraisal of this, you find out that many of these are just doing this on impulse and for selfish political gains, which is very, very sad. So for us to really move forward, there is need. Raji, went step by step the different things that will be required. And then this issue of collaboration. There is this mentality in Africa that anything African is bad. And that is why many investors are scared, because if they manufacture vaccines in Africa, they are not sure if other African countries will buy it. Unless it comes from elsewhere, then it must be good. Now, this African free trade, thank God, I hope it will not go the way the others. But if properly implemented, this issue of collaboration we are talking about will work better. This spider web of actors I mentioned, which has been alluded to by all the other speakers, will work better because then Ghana can comfortably produce something and send it to Nigeria, to a factory in Nigeria to work. And the same thing, Benin Republic, same thing from South Africa and elsewhere. But do you know it is more difficult for inter-African trade than between African countries and other countries outside Africa, which is very sad. Why is that? We are talking about single monetary union, we're talking about African free trade. Let's see how it works out. The summary of what I'm trying to say is this. I think we need our leaders, African political leaders, owe us that commitment, sincere and genuine commitment to make things happen. We have the wherewithal to make these things happen. But there is just that lack of leadership, lack of commitment, and of course, the other word which I prefer not to call. I think these are the things that are, and then finally, and this is not politically correct, and you can expunge it from the film. You know that if you want your child to be perpetually dependent, provide everything that child needs, including bathing the child until the child is 16 and 18 years. Africa, one of the challenges we have, we are grateful to our benefactors, but one of the challenges that Africa has had is because we know that the Western world will always raise money to support whatever we are doing in Africa. There was a time when the world sanctioned Nigeria. I was in university then. For 5 years, Nigeria was under severe international sanctions. The average Nigerian did not feel it. Nigeria grew its own food, ate its own food, provided for itself. Unless maybe those that fly to America and elsewhere to go and shop and so on, the average Nigerian didn't even recall that there was a sanction. Why? Because that pipeline was blocked, and we suddenly found out that the average Nigerian could be self-sufficient.
Self-sufficiency, Chidi, we only have a few minutes left. So I want to just get to a very practical question which we wanted to answer in this webinar. And that is a point that some of you raised, and Raj, you went into a little bit more detail, and that is all these production inputs that go into the fill and finish process. And Simon, maybe you, since you are setting up the manufacturing facility now, you could also give us some insights. And Paul, you've been there and done that, so you could give us some insights from your past experience. What are the opportunities there for localization? And, in terms of equipment, in terms of other components, etc. I think we can agree that there probably are lots of opportunities for localization. But if you are coming from a market that is a non-manufacturing country, you all talked about the importance of collaboration and cooperation, and we have many more opportunities under the Continental Free Trade Agreement. How would you go about exploring or unpacking what those opportunities are? That's my first question. My second question is, what is your recommendation to policymakers in terms of how those opportunities should be managed? In terms of industrial policy, what are the policy recommendations that should be made? We know that we have firm recommendations in terms of manufacturing. Those are already in place. But what are the other recommendations that should be made so that we don't miss those opportunities and then we continue to import everything else? So I don't know who wants to start. Raj, maybe you?
Okay, thank you, Kirti. Yeah, sure. Actually, there are more than 200 components of a vaccine which have to be going into various products. So, one can take a lead from there that which are the critical components which are common in all vaccines. And probably look for partnerships to start with, because starting de novo will be probably difficult, but look for partnerships with those experts who are already in the field and are creating those opportunities worldwide. So I think that would be a starting point to establish ancillary industry for those products into the African continent. And based on that, and there are certain, packaging, for example, is something which is very, simple. We are talking about corrugated boxes. You don't require a rocket science or a thermocol. So those are some of the things, but these are critical components of vaccine delivery. And whether it is syringes, whether it is vial, because vial making is not so simple that we can easily say that we can start the vial manufacturing, because it's the quality of glass and then the tubing, then everything else going into that. But there are companies who can probably be looking forward to large, manufacturer like Schott from Germany, and have a kind of a collaboration there. So I would say few components to be selected, and then the partners to be identified clearly, and then collaboration agreements to be put in place to start with. And then slowly you can expand to the other components and then complete the value chain.
Mhm. Simon, do you want to add anything?
Well, I think,
You're managing this.
yeah, Mr. Suri said it all. I mean, we can't pretend to want to domesticate everything immediately. It has to start with collaboration, and without collaboration, there's no way you can make this happen. So collaboration, initially, you get the job done, and then you can now go into some strategic agreements on how that technology will be transferred. It has to be a win-win situation. We shouldn't think that you put this down, you're cutting off everybody. No, even if that technology is transferred, the partners still get royalty. So everybody is happy. And that is how to make collaboration succeed. This initiative is not to cut everybody out, to say we want to do it ourselves, it will succeed, it will work out, but if you make great environment where every party involved in that process succeeds, then it becomes a successful venture. So I agree 100% with Mr. Suri. We need to build those collaborations. I mean, like what we are doing right now with Merck. They are building everything, the media, everything is coming from them, and so on. We deploy this facility on the continent. We cannot depend on those components from them. And then at some point you reach a distance, and, oh, okay, I think let's begin to domesticate, let's say, the media. For example, how do we make this happen? We are vaccine manufacturers, so there's another company that is doing that. So how can you transfer that technology to them to work? So if they're transferring the technology, then there should be royalty payment to them, which they will be very happy, to transfer the technology because they are not losing out, and so on. So all these things will play out, but the first thing is to get these technologies in collaboratively, create environment where everybody succeed, and all the other, because if you want to answer all the questions now, you never start. Over.
One very quick addition, please, if I may, is what I also prefer to call affirmative action for vaccines in Africa. When anybody virtually manages to set up, that's a recommendation to policymakers. There should be deliberate policies to protect the market and support these initiatives. I know because this issue of free market kills local initiatives, and I think we need to find a way of really implementing affirmative action. But it shouldn't be an open-ended affirmative action. It should be time limited, so that the companies don't just take it for granted that, well, we are protected and that is just it, and keep going and so on. So time-bound, limited affirmative action for local manufacturing industries really help to grow the business.
I agree. I mean, Raj has been very helpful in outlining what could happen. Having a local industry provide some inputs, finding commonalities, things that everybody uses, like in the pharmaceutical industry. We talk for years. The simple thing like pharmaceutical starch for making tablets still has to be imported. And it is very clear, somebody sets up a plant like that and supplies good quality, that will be extremely useful for everybody. But my own last remark still has to do with the policy end of it. I think as we talk, we need to put the feet of our governments, the African Union, and all of them to the fire. Don't come up with policies and initiatives that are unfunded. You need to find a way of making money available to implement.
Okay, great. Well, thank you all. I think that's a good place to end the discussion. Unfortunately, we have run out of time, but it's been a very rich and intense discussion. There's been a lot of chatter on the chat room, which we will try to respond offline to some of the people that have asked questions. I'm now going to hand over to Faisal to give us some closing remarks before we end the webinar. Thank you all.
Thank you.
Well, thank you. I must say I've been listening with fascination. This discussion has been so rich and insightful that I'm sure our young researchers here at the university and across the continent are going to draw on the issues you've raised and the questions to stimulate a great deal of their own research. But I want to say, really, as the only non-expert in this panel, I don't have any expertise at all in pharmaceutical products. The only claim I have to some role in this is I led the negotiation in Geneva almost 20 years ago now on TRIPS and public health. And it took us some time. We got to understand the industry very well, especially big pharma. And we collaborated very closely, working together with India, Brazil, China. I was there representing South Africa and the African group of countries. And we made a lot of progress. We did succeed in putting this issue on the map, and we did succeed in gaining some flexibilities in the TRIPS agreement, which did reduce significantly the prices of AIDS drugs at the time. And now again, I think the pressure that is being put by our negotiators in Geneva, led by India and South Africa, has put the issue of COVID and inequity of the patents regime on the global map again. So what is different this time? I think this time the excitement that I think all the speakers have alluded to, even though you've done so with great caution, is the fact that we have a new game in town. We have the African Continental Free Trade Area in Africa. This brings together a market of over 1.2 billion people. It means that we are going to trade more with each other. African countries don't trade very much at this stage, but most of what they trade is manufactured products. So there's a great opportunity for the expansion of trade in manufacturers on the African continent. But I think the other great opportunity we saw with the sterling work of the African CDC is the opportunity to procure together. So if we can combine forces, we can negotiate with big pharma, with investors to localize production by negotiating for access to our procurement markets. We are the biggest buyers, our government procurement, and so there's a tremendous opportunity there, and we have lessons already and experience to show. The third, I think, thing that the AfCFTA does is that it helps us to build regulatory coherence and coordination. We've already taken steps with the African Medicines Agency, but how to increase coordination of regulatory agencies, build more cohesion and harmonization of regulations. That's on the agenda of the AfCFTA. How to deal with non-tariff barriers at the border, trade facilitation, improving customs. That's also an issue of the AfCFTA. And interestingly, this discussion is going to help those negotiators in the AfCFTA who are now working on the zero draft of the intellectual property rights agreement of the continent. So the AfCFTA in its second phase needs to build rules across the continent to encourage the creation of one market. And intellectual property rights is one of those issues. So this discussion that you have all contributed to will stimulate our minds about how to stimulate research and how to create patent pools on the continent, and how to encourage collaboration in building patents across the African continent, and in research and development. So I think a lot here you have contributed already. You've also spoken about industrial policy and, you know, problems of implementation of the African industrial policy, the plan for pharmaceutical manufacturing, which hasn't yet been implemented, but its time has come. We have launched this process of building regional value chains. It couldn't have happened before, but now with the AfCFTA, it certainly can happen. I'm very excited about the discussion about not just producing vaccines, but the whole value chain of products that go into the manufacture of vaccines, from vials and seals and you know, over 200 components that I think you have spoken about. So how do we share the process of benefits from manufacturing in Africa? There are plenty of opportunities to do that. Many countries will have something to contribute if you expand the manufacturing across the whole value chain. The third thing you've brought to our attention is the need for access to finance. We started a discussion of how African countries can collaborate in strengthening their development finance institutions. What I learned recently is that there are over 100 DFIs, development finance institutes, across the continent. Many of them are very small, but if we collaborate, if we regionally or sub-regionally, we can strengthen their capacity to provide better access to finance for both our infrastructure and our manufacturing, such as pharmaceuticals. The fourth thing I learned is the power of cooperation on the continent. This discussion itself is just absolutely fascinating. The whole tenor of the discussion is one of cooperation. If we can stimulate this, encourage discussions amongst universities and technicons, researchers in our various countries to collaborate, think tanks, we can use our public dialogue forum in this school to stimulate that. So thank you so much for kicking off that discussion, and I'm sure Kirti will follow. And finally, I want to say I was very pleased by the input that some of you made, especially Mr. Rajinder Suri, about how we can learn from each other in the developing world. There's no doubt that India is a leading player, and you reminded us that, well, just 20 years ago, India was also struggling. But look at the enormous distance it has covered. It can produce end-to-end manufacturing. There's no reason why Africa working together, learning from India, collaborating with India and others, can't also build its capacity. And here too in Africa, we have some experiences that we can learn from, like the industrial parks, for example, on pharmaceuticals that were created in Ethiopia that Dr. AfCFTA told us about. So 5 significant learnings for me as I listen to you, a non-pharmacist and a non-expert. And I really want to thank all of you for stimulating this dialogue and setting this us off really on an amazing journey to stimulate manufacturing in Africa on vaccines and pharmaceuticals. So thank you so much to all of you.